I don't have the conviction to be vaccinated.
It's okay for everybody to take vaccine.
I cannot go and do that particular vaccine. It's not helping matters at all.
And if I have the access to it, I will be vaccinated.
A vaccination that people will be forced to do, what is the brain behind it?
Early investigations in China acknowledged some people showed symptoms in early December 2019. While some of the earliest known cases had a link to a wholesale food market in Wuhan, meanwhile some did not. Since the outbreak of the deadly coronavirus, countries of the world have come together to find a common solution to the disease, which has dealt a huge blow on the world economies. The World Health Organization's Director General, Tedros Ghebreyesus, on March 11, 2020, at a news briefing, declared the novel coronavirus outbreak a global pandemic. The pandemic has made scientists around the world to work round the clock in search of ways to predict and limit future outbreaks of similar diseases. This move by the scientists has seen the production of vaccines such as the Moderna COVID-19 vaccine, Oxford AstraZeneca vaccine, Pfizer COVID-19 vaccine, Johnson & Johnson, and more to stop the deadly spread of the virus. The Federal Ministry of Health in Nigeria reported the country's first case of the COVID-19 on the 27th of February 2020.
The case was confirmed on the 27th of February 2020 and is the first to be reported in Nigeria since the beginning of the outbreak in China in January 2020. It is an Italian citizen who works in Nigeria and returned from Milan, Italy to Lagos, Nigeria on the 25th of February 2020. The patient is clinically stable with no serious symptoms and is being managed at the Infectious Disease Hospital in Yaba, Lagos. And
Nigeria has so far recorded 165,778 cases and discharged over 156,415, and at least 2,067 people have died from the disease. On the 2nd of March 2021, Nigeria received 3.94 million doses of the AstraZeneca Oxford vaccine manufactured by the Serum Institute of India from Mumbai. Nigeria also received another 100,000 doses of Covishield vaccines from India. Currently, Nigeria has vaccinated at least 1,794,552 across the 36 states of the Federation and the Federal Capital Territory. Curious on the slow rate of the vaccination exercise, TOS Television engaged some health experts in a chat to establish the rationale behind lack of interest on the part of citizens to get vaccinated.
Ignorance, largely, I would say, is responsible for all of this, and people not wanting to really take some certain information to themselves because of maybe their religious faith. Because there are some people or some religious believe that they have been told not to take the vaccine and all of that. So these are the issues that is actually mitigating against the increasing number of people being vaccinated about the COVID-19. Few people were used to do this experiment, and they found out that, okay, there are recorded adverse effects. We call it adverse effects that are recorded. But now, they might not be able, during that period, maybe they didn't get anyone with this blood clot stuff. You know that of the world, we are over 6 billion in the world. So of that 6 billion, they didn't get up to like 300 people to do for that stuff. So 300 is not actually a true representation of the entire populace of the world. And now this vaccine is being thrown to the world, and everybody can actually have different reaction. Just like, see, if I take chloroquine, I don't feel anybody itch. But someone else can take chloroquine and the itching can be very severe.
It is still being studied. Let's give the world a chance. If America, that as big as they are, global, very with a lot of educated people, can give some things a chance, you understand? Then how much more we that are Nigerians that we learn and we take everything from them and from the all because of the world power and all the globalization and all. So I think we need to give this vaccine a chance.
On the other hand, Nigerians on the street of FCT also spoke on why they will never get vaccinated.
Some people will definitely have that particular vaccine, After some days, they will go back home. They will go and be experiencing some challenges, some health challenges. So I don't have that confidence for me as a Nigerian, and I want to save my life, and I want to save my life of my family. I cannot go and do that particular vaccine.
No, I will not. Till eternity, I will not. Reason being that a vaccination that people will be forced to do, what is the brain behind it?
As the saying goes, there are two sides to a coin. Why some vowed not to take the vaccine, some are ready to take the vaccine but do not know how to go about it.
I want to be vaccinated because I want to live a healthy life and I want to be free from disease. I don't want to die. I want to live long to my expectation because this Covid-19 is a deadly disease and it's killing people and it's real. So one don't have to take things for granted. It's just I've been hearing of people vaccinating, getting the vaccine, but I wonder how they get it because I have not gotten access to that. And if I have the access to it, I will be vaccinated.
I took my vaccine last 2 months ago. Nothing, there is no reaction. Nothing happened to me. So, but when you take your vaccine, you must wear your mask back.
The National Primary Healthcare Development Agency, through a tweet post on its official Twitter handle on Saturday, May 15, 2021, announced that second-dose vaccination with the Oxford AstraZeneca vaccine has commenced. The exact origin of the novel coronavirus remains a mystery to this day, with many streams of the virus raising global concerns.